Medical speak is a foreign language, right? Doctors are constantly speaking in this confusing mixture of acronyms, initialisms, and Latin. But there's one phrase that doctors use that's plain English and actually sounds kind of bland, kind of benign, but has serious implications if you hear your doctor say it. That phrase is goals of care. Let's talk about what this phrase means, why it needs to be on your radar, and what to do if you hear your doctor say it. I'm Dr. Matthew Tyler, and this is How to Train Your Doctor. All right, let's talk about this phrase goals of care and what it means. On the surface level, goals of care means what you're hoping to achieve by seeking medical treatment. And this is a weird thing for people to hear and examine because most people feel like it's obvious what they want out of their health care. Some combination of feeling better and living longer, right? So what's the problem? The problem is that when doctors use the phrase goals of care, what they really mean is that they're worried about your current plan of care. They're worried that the medical treatment that you're getting is unlikely to achieve the benefits that you expect them to achieve. Meaning they're worried about how well you're going to live moving forward. And they're worried about how long you're going to live too. And so what doctors are trying to do when they use the phrase goals of care is pause and have a conversation about what's important to you, what your priorities are, how you want to spend however much time that you have moving forward. The thing is, doctors are really bad at sharing bad news. They're really bad at being straightforward with you when things are not going well. So what I see happen a lot of the time is that doctors try to tiptoe into these conversations by saying something like, we need to discuss your goals of care. And they've skipped the part where they tell you why. They've skipped that serious context that you need to have a meaningful conversation and to make big decisions for yourself or someone that you're caring for. So what you really need to know when you hear the phrase goals of care is that your doctor is trying to have a very serious conversation with you, and likely one that revolves to some degree around life expectancy. What you need to answer for yourself is, are you ready to have that conversation right now? Are you ready to talk about what's most important with the time that you have? Are you ready to talk about priorities? Are you willing to discuss trade-offs of one treatment pathway versus the other? And if the answer is yes, awesome. That's so awesome that you're ready to jump in and have that conversation. And what I would advise you do, if this is you, is to ask your doctor to pause, back up, and be clear about the context that they're coming to you with, meaning what is the medical information here that you need to make important decisions for yourself? What is the life expectancy that they're worried about? How do they see your future moving forward? Have them paint a picture for you so you can understand what they're seeing and arm you with that information to make these big decisions. On the other hand, if you're hearing this phrase and you're being caught off guard by it, you thought things were going far better than what the doctors are clearly seeing, and you're not ready to have that conversation right this minute, that's okay too. What I would recommend if this is you is to, again, ask for a pause and to set up a time with your doctor to revisit this conversation so that you can prepare yourself for it. Either way, whether you're ready to have that conversation now or later, strongly recommend that you ask for the support of a palliative care team to have that conversation with you. I mean, the thing is, this is the wheelhouse for palliative care teams. They're experts in helping people navigate serious situations and coming up with plans in a way that honors what's most important to you. Yet, despite that, docs are still kind of bad at asking for palliative care consults too. So you may need to ask for that yourself. You may need to ask for a pause to bring a palliative care team into this conversation too. And I would hope that you would find the palliative care team support very helpful to you. And hey, I hope you found this video helpful for you as well. Thank you so much for watching.